Yesterday, BAMC received 8 patients in support of the response to the tragic mass shooting in nearby Wilson County. Our thoughts and prayers are with the victims and their families. Standing alongside of every one of those patients, we understand that there are many friends and many families who are grieving and trying to recover from yesterday's events. I had an opportunity to speak with some of the family members last night and assured them we would keep them informed of the treatment of their loved ones and that they are in good hands in the treatment they are receiving from our expert trauma team here at BAMC. The patients we received yesterday have significant injuries which will change their lives and require significant healing and rehabilitation. We have already started addressing physical, mental, and spiritual needs which will continue during their treatment here at BAMC. Although we are deeply saddened by the circumstances, BAMC is honored to serve our community in the role as a Level 1 trauma center. We train every day to be ready at a moment's notice, whether it's for a natural disaster, for a mass casualty event, or for combat. Our staff stands ready to meet the needs of our community. Our nation expects this of us, and we stand ready. We are proud to serve our community and our nation. We are unable to discuss the specifics of patient conditions, as I assured those who gathered last night. We will protect their privacy as they mourn and as they recover. However, we'll be happy to take your questions regarding BAMC's role as a trauma care center and the support that we provide to our community. What are your questions?
You said that you had some life-changing injuries that you saw. Can you go over the patients that you took in and how many and what their condition?
Yeah, as I said, I won't go into any of the specifics of the patient injuries. We did take in 8 patients. 6 of them were adult patients, 2 of them were minors. And obviously, coming to a Level 1 trauma center implies that they have critical injuries. And I think the injuries that we see are consistent with what we hear reported through law enforcement for the type of event that took place.
That means bullet wounds, they got a black bag, helicopter.
Right. 7 of our patients arrived by ground ambulance. 1 patient arrived by air ambulance. And again, the injuries that we see are consistent with what we're hearing reported through law enforcement channels of the event that took place.
We talk about preparedness for actually treating these patients, but what about preparedness and staff in terms of responding and seeing these sort of injuries?
Yeah, it's a great question, and I really appreciate it because it is just as important for us to know how to respond medically, technically, to the injuries, but there is a tremendous role that is played as well on the psychological mindset of our staff as well. And this is something that we take very seriously. We train for that as well, and we have experts moving throughout the facility even today to determine where it is that our staff need assistance. As I've interacted with some of the staff this morning, they're already reflecting on the impact of understanding that they're really no different than the people who they're treating today, and we all could be in the same place. And obviously that's an important role for us.
When you say that you have minor patients, can you tell us the age of those minor patients?
Yeah, the definition of minor would be less than 18.
And 2, we have 2.
Yes, ma'am. 2 minors and 6 adults.
Are those 8 people still being treated here at this hospital, or have any of them been discharged?
Ma'am, we continue to treat all 8 patients, and we'll continue to take care of them until their needs are met and they can safely be transitioned to outpatient status. It doesn't matter for us here whether these patients are military members or affiliated with the military. We have a authorization to be able to take care of civilian trauma patients inside of the greater San Antonio metro area, and that's how we've been authorized to take care of these patients.
Can you tell us if these were 8 separate families, or do you know how many families are involved?
Yes, ma'am. That detail is not something that I'm prepared to share with you. I can tell you we have 8 patients, and we are very happy to take care of all 8 of them, providing them the expert trauma care that this organization is well known for.
Can you explain the decision-making between bringing them to this level 1 trauma and then the patients that went to university? Was there a reason for the type of care in that decision?
Yes, ma'am. As is routine for this part of Texas, we have a medical regulating cell that all of the trauma calls come into, and they then divide those patients by where they can best receive their care. And so that care is looked at both by what kinds of injuries they have. It's also how many patients have preceded them. And so yesterday what we saw is a division of the trauma patients between the 2 level 1 trauma centers, 8 of them coming here and other patients going to University Health System for their care. So that medical regulating takes place at what types of injuries, what the acuity is, and what the capabilities are in each one of the centers.
With Sutherland Springs being so far, were there any lessons learned as to transporting them here as quickly as possible yesterday? Or?
Ma'am, I heard that all of the transport went very well, and that it is about 30 minutes away, and we do have the ability to move patients by air, as you heard for one of the patients we received here. On the ground, the on-site medical authority made the decisions of whether somebody was stable enough to transport by ground or by air, and everything that we see is they were making great decisions really in a pretty chaotic environment yesterday. And my hat's off to that medical authority.
Did any of the patients come from Connolly and Memorial Medical Center, or they're all from the scene?
Yes, sir. The patients that we received yesterday all came directly from the scene to our emergency department.
And to what degree are you helping family members that are coming in to see their loved ones here at the hospital?
Yeah, so clearly the treatment of family members is just as important. And we saw that immediately when family members arrived here yesterday afternoon. I had a chance to meet with them mid-afternoon yesterday and just describe for them what was taking place, how it is that we were caring for them, and what we expected to take place over the next 24 hours. So some of that just information sharing in the immediate grief stage is really what we look to do. Now today we're beginning to transition that. Our chaplains are much more engaged today, as well as with our behavioral health folks. We need to find which of those avenues is best for each patient and tailor our approach depending upon where they are in the grief stages, as well as in how it is that they interact with society. Yes, sir. Any other questions?
Again, no time on when patients will release and treated.
The timeline is all going to be driven by their medical conditions, and I suspect that each one will be slightly different. We see a wide range of injuries. All of them were needed to go to our operating rooms yesterday, but everybody heals a little bit differently, and we'll make those medical decisions with regards to discharge from the hospital based upon their recovery.
Apologies if you already said this, but could you please tell us how many are male and how many are female?
I didn't say that. We have 8 patients, 6 of them adult and 2 of them are minors. Again, my goal is to try to protect the privacy of each one of our patients and ensure that, as you mentioned earlier, we don't add to the grief by somebody learning something that a patient or a family member didn't want them to know.
Can you talk about the transportation again? I'm sorry I missed that part. How many were airlifted? How many were driven in via bus?
For here at BAMC, 1 was brought in by air ambulance, helicopter that landed on site. The other 7 were brought in by ground ambulance, multiple different vehicles transporting patients when they were ready to come off of the scene. Yeah, so I apologize for the aircraft. Let me make sure I heard the question. I think the question was the decision to choose what level 1 trauma center, is that made at the scene or is it somewhere else? It's not made at either of the level 1 trauma centers, university or here. It's made by MedCom. MedCom is that patient regulating organization that is set up that every day of the year makes these same kind of decisions. They made those same decisions yesterday in the same way that they always do.
And last thing about the doctors treating these victims, they had experience, say, because this is BAMC, they're overseas and Afghanistan. Can you describe the doctor's experience and what they face with these patients?
Yeah, no, I appreciate the question. To me, there is no better place for a trauma patient to come than to Brooke Army Medical Center. I state that for two reasons. The first is that we receive about 10 trauma patients every day into our emergency department. So the 8 that we received yesterday are something that we do every day of the year. We benchmark ourselves against national standards for success, and this organization, I'm proud to say, beats those national standards. The other reason that I'm proud to say that those patients are going to receive excellent care here is the experience that our surgeons, our nurses, our technicians have on the battlefield. Obviously, the injuries that we heard reported through law enforcement yesterday are the same kinds of injuries that we see on the battlefield. And for us to translate the way that we provide care on the battlefield to what took place yesterday is very natural for us, and gives us an opportunity to have that expertise that is available to the community here in San Antonio. All right, any other questions? Thank you all for coming out. I appreciate it, and we'll continue to take care of our patients that we have here, and we're happy to engage with any type of additional queries that you might have, sending those through our public affairs officers. Thank you very much.